Hello, everyone. This is Dr. Dhavashree, one of the mentors at StudyMedic and StudyMRCOG. And we are here with yet another back-to-back series on the topic of postoperative care. So postoperative care is a very important module, I would say, because it's a module where your postoperative care skills are evaluated. Okay, so basically there are only few important things which we should be concerned regarding this postoperative care. And there has been many important modules where the stations would be very lengthy, like that of the maternal medicine, antenatal care, labor and delivery. Here, this module may not be a longer ones, but they are important things in a way that where our knowledge and applied clinical knowledge is being tested, or patient safety is also tested. And usually, what is that we'll have to prepare in this module? Okay, basically, candidates are expected to understand the principles of postoperative care, and that is what is needed as a ST5. Okay, so what is that we are expected to know in this module is that how are we going to provide an immediate postoperative care, especially in women who has had a complication, and then women who has not had a complication. What is the postoperative fluid therapy, or how is that we are going to manage with a catheter? So many postoperative care things are included in this. It can be ones without complications or one with a complications. And the other important principle behind this postoperative module is identifying the complications arising from the surgery in the immediate postoperative period, or in the late postoperative period is very crucial in case of a doctor who is supposed to be a safe doctor. So basically, this module would test the capability of the doctor to identify the complications which arise because of the surgery. And the other important thing that we'll have to remember and prepare is the how to incorporate the enhanced recovery in program into our regular routine postoperative care practices. So these are all the things which they would check in case of principles of postoperative care. Okay, this is something. So in the immediate postoperative care, what is that they would want to know is any surgical procedure, whether it is a major gynec procedures or a complicated obstetric. Usually, obstetric procedures without any complications usually is not a important thing, but for an ST5 we are supposed to handle complicated obstetric procedures, so like that of a cesarean hysterectomy, rupture uterus, massive PPH, or even major gynae surgeries, anything on that note. For example, an abdominal hysterectomy, a vaginal hysterectomy, complicated abdominal hysterectomies, laparoscopic hysterectomies, hysteroscopies. So all these things with or without complications. Okay, so we should be able to we should be able to substantiate the post-operative care for all these procedures that we undertake. And the other, as I said, identifying complications that arise because of the surgeries. Example, most commonly it could be a postoperative bladder injury, or it can be a postoperative ureteric injury, or a postoperative bowel injury, could be that, or even an syndrome of inappropriate, that is postoperative hyponatremia, which can develop in a woman who does not have any other complications. That can be one of the stations which we can. So we should be able to identify these complications in the postoperative period, and even a normal postoperative ileus, or a postoperative nerve injuries, or a vascular injuries. All these we are supposed to identify these complications at the earliest and do the appropriate management care. So these are the basic idea of the postoperative care. So what kind of stations do we get? Basically, it can be a patient-simulated task, or it can be a structured discussion. Patient-simulated task can be anything in this world. especially those dealing with the complications. So the woman might be puking immediately after a complicated surgeries, where we will have to identify what it is and talk to her, address her concerns and make a management plan in such cases. And regarding a structured discussion, it can be a scenario where the examiner would ask us a question and they can have a variety of investigations or an imaging photograph, so that we should be able to identify those investigations and make an appropriate diagnosis based on the clinical situation and then derive at a management plan. So this could be either of this, and all the 5 domains would be actually tested in this module. So one is the communication with the patient, which is very, very important. The other one is information gathering. The third one could be a communication with the patient or with a colleague and applied clinical knowledge. So all these would be tested in this station. So coming to that, how do we deal with a station which has a post-operative care module? So basically, when we read out through the question, we will have to be aware of what is the situation. For example, it would be in the post-operative period. Is it an immediate post-operative period? How long has it been since she's out of the theater, or how many days is it after the surgery? So this situation is very, very, very important for us to have a differential diagnosis. So for example, if the woman is vomiting in case of a deeply infiltrating endometriosis, okay, with an rectovaginal nodules. In such cases, when the woman is vomiting, later, not in the immediate postoperative period, in the later part of the period, then it should strike us regarding a bowel injury, late bowel injury, especially in the rectovaginal areas. Okay, so we should be able to identify ourselves in what situation are we in. So that is something important. And as I said, identification of the complications, whether it is an ureteric, whether it is a renal, or is it a bowel, or is it vascular, or is it a nerve, is what is important. And whatever the situation is, okay, we should be able to justify those case scenarios with the appropriate investigations, what we would be doing. So we need, as I always say, justification is something very important, especially in case of a structured discussion. Structured discussions, when we talk to the examiner, we should be able to tell them why we are asking information and why is that we are doing an investigation. So justification was what would fetch us the mark, rather than just telling them what is the investigation that we could do. And again, an appropriate management plan, if it is a patient simulated task, to derive at with a shared decision making, having to make a management plan for the woman. Or if it is a structured discussions, then we'll have to talk about the options of the management for the problem that is identified. And please do not forget, this is something very, 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 very important in case of a post-operative care module, is involvement of a multidisciplinary team. So remember, if we do not blurt out this multidisciplinary team in the post-operative care, then probably we are not scoring in that module. Okay, so that is something very important in case when it comes to communication with the colleagues as well as the patient safety. So with that, what is that we will have to do in case of a information gathering? So we all will be having a template in our mind when it comes to information gathering. But remember, things to be done in case of our information gathering is situational awareness. So when we identify ourselves in the immediate postoperative unit, okay, especially in the postoperative ward, immediate postoperative ward, is that you who has done the surgery, okay, that you should be able to identify, or is it that you are just delivering her the information of a surgery that she has undergone, which was done by somebody else. So all these things are very important. And when you go there, when we go to the when we talk to the role player, first thing is identify yourself. Okay, this I would be telling you in the communication with the patient. But remember, situational awareness. So in case of a woman who is in the immediate post-operative ward, you would be having all the details of the patient, which usually would be provided to you, which you could have seen. And when you go there, you would basically have a good idea of what was the history of her. So please do not go to the woman and ask her about the previous history. That actually takes away a lot of your time. So please do not waste your time on asking a history for a woman who is in the immediate stuff. So what is that we can ask as soon as we reach to her? Is that ask her about the pain. So be empathetic. That is something very, 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 very important in case of a post-operative module, where the woman would definitely be in pain. So ask her about the pain, be empathetic, and offer her a pain relief if she really says that she's in pain. Okay, and then talk about the intraoperative issues. If you have had an intraoperative complication, then tell her what was the complication, deal with that, and again, duty of candor is something very important in that place. But remember, information gathering. If we have to have few important things, especially endometriosis, all those things. Remember, fertility is always an issue, and you will have to address that concern. Okay, ask for information regarding and then address a concern there. Okay, and also any investigations that has been provided there, probably though it is a patient simulated task, or it can be a stimulated task, or it can be a structured discussion, whatever it is. When they give you an investigation, so please look at please identify the investigation, whether it is of the same patient that you're dealing with. Sometimes they could have just given you a name, an investigation which does not belong to the limit. So please identify the patient's name, whether it is the same, it is the investigation of the same patient. Okay, that is something important, which actually is again a patient safety point. Okay, and please interpret what is the investigation. So what is that is done? So identification of for any investigation, identification of the patient details, and identification of what investigation. And the third thing is the results of the interpretation should be explained to the either if it is a patient simulated task to the patient or to the examiner. And please remember, in information gathering, especially in the post-operative module, please do not ask about a complete history. Okay, so that in the post-operative module, it is information gathering is not about taking a template or the template that is there in our mind of asking the whole history. So history is looking into the post-operative, looking into the notes, then talking to her regarding the pain, offering her pain, address her important issues or concerns she has, and then basically look into the investigations that has been provided. I hope we are very clear that in the complete history taking for a woman in the post-operative module is not very important. And again, information gathering, something which is important is if she's had a massive BPH, I'm sure they would have given Jehovah's Witness. Plus, please do look into whether she's a Jehovah's Witness. Okay, that is something very important. You cannot be offering her blood transfusion without without the history of Jehovah's Witness. And again, if you again another important thing is allergic history if the woman has sepsis. Okay, this could be a post-operative sepsis also. So in which case we will have to ask about drug allergy. So these are other important things which should be, these information has to be gathered. So coming to the communication with the patient and colleagues, definitely very important is that you will have to introduce yourself properly. properly. So this could be a angry patient station where the woman is in the post-operative period and she's had a massive she knows that something has gone wrong. She may be very angry. So very important thing is when you go inside, you will have to introduce yourself confidently and properly. Okay, please do not fumble here. So you will have to say that you are so and so, and you are the doctor who has done whatever has been given there. So if the station says that you are the one who's done the operation, you will have to say identify her by her name because you know who she is. So you go there, you introduce yourself, and you identify her with the name. Okay, so you can say Mrs. Rebecca. Okay. If you want, you can ask her regarding the age, but then I am Dr. So and so, and I am the one who's done the surgery, or you can say, I'm the one who is come here to talk to you. Has anyone spoken to you regarding the after your surgery? So if she says no, then you say, I'm here to talk about it. Is it okay? How is your pain? So this is something important. The communication with the patient is something important, which you will have to do it confidently. And remember, empathy has to be there along with that of a confidence. So that makes you a better and a safe doctor. And appropriate communication of the finding is very important. So we'll have to give her all these details in a small chunks in a non-medical jargon, okay, so that she understands, which we will have to say in a patient understanding language. Okay, but if it is a structured discussion, always, if we will have to summarize all the details, use the S-bar format. S-bar format is something very important, and this will tell you that you have a good knowledge of what the situation is. And remember, involve the MDT appropriately. That is very important because though it is a patient safety, MDT involvement comes in everything. So please do not forget MDT, and debriefing is something important. So yeah, in case of MDT involving MDT, it becomes a communication with the colleagues. But if there has been a complication, always with the duty of candor, debrief her appropriately. Okay, that is very, very important in case of a communication with the colleagues. And please do not, as soon as you enter the cubicle, please do not ask them, can you confirm your name and age, please, because she might just jump on you saying that you are the one who has done the surgery and you do not know who am I, she might. So women who are in the inpatient, okay, it's always good to confirm, tell her, identify her with the name. Okay, that is important, and please do not ignore her concerns, and do not manage the complications by yourself. Managing with the multidisciplinary team is something important. Coming to the patient safety, very important thing is if we are going to talk about antibiotics in the postoperative period, allergy, ask the history of allergy. If that doesn't, then probably we might lose the station. And if the blood transfusion is required, please do not forget that whether she's a Jehovah's Witness, always ask about VTE risk assessment and thromboprophylaxis. And remember, incident reporting and risk management is again a patient safety point. Okay, so all these things put together will actually, even if you do not know the what kind of complication it is, then probably when you put all these things into places, I'm sure you might be able to go through the station in a good way. Okay, and applied clinical knowledge, probably it's basically the idea of your clinical knowledge which you have learned in part 2, and then appropriate application is what is expected. So we should be able to know the post-operative care of the patients, everything, fluid management, analgesic, oral management, enteric management, and then pain relief, antibiotics, thromboprophylaxis. So all these we should be able to tell her, take her through the post-operative care. If the complications happen, give her the management plan for that, and as well as a regular post-operative care management. So we should be able to tell her the fluid management. We should be able to explain the evidence-based management of the complications that has happened. Okay? And definitely involving the multidisciplinary team is something which comes in all of those. So except the information gathering, all of the other things, multidisciplinary team involvement is very important. And so when we address all these things, I'm sure we would be able to get through the station very well. So what would be the possible cases that we can get in case of a postoperative module? It can be a postoperative urethric injury after a difficult laparoscopic injury, or a abdominal hysterectomy with a or a staging laparotomy involving the pelvic lymph, pelvic dissection. Okay, or it can be a VVF, or it can be an RVF, or it can be a postoperative bowel injury. It can be a simple postoperative ileus. Okay, or it can be a postoperative hyponatremia like that of SAADH. So I think there has been situations where SAADH has been asked. So please go through this SAADH. It can be a vulval hemorrhage, which they could ask, or it can be a postoperative nerve injury. Okay, or it can still be a postoperative vascular injury where, for example, it can be an inferior epigastric vessel injury in a laparoscopic, diagnostic hysteroscopy. Anything on this can be a case. Only thing is we will have to put everything in pieces and talk about the immediate care, the fluid management, if necessary, the um, and definitely pain management, thromboprophylaxis if necessary, antibiotics, and then incident reporting if there has been a complications, risk management if necessary, and involve the MDT. So all these things would tick a box, and I'm sure we would be able to pass the station if we have this in our mind. So this, I think I've given you a good view of a post-operative module. So I'm sure we would be back with few other modules on this back-to-back series. I hope this video helps you in preparing for the post-operative care. And I'm sure you will have multiple other videos on the other modules too. So if any questions, you can reach out to us, and thank you so much for viewing this video. Thank you so much.